No, I don't have health insurance.
No, I don't have, honestly.
I don't have health insurance.
I said I don't know what is health insurance.
Health insurance is a form of financial risk protection such that while assessing healthcare, finance should not be a barrier. In addition, assessing healthcare should not impoverish me, should not make me poorer. So if somebody is poor and then go to assess healthcare and then they have to pay from their little savings, such that by paying for healthcare, they may not even be able to take care of their household needs, buy food, shelter, and all of that. So that's why financial risk protection is important within the health systems space. And that is what health insurance actually does.
Definitely, I use health insurance. And in fact, even because of health insurance, about 2 months, 3 months ago, yes, about 2-3 months ago, would have been a forgotten issue. Because I had this severe ulcer. I didn't even know it was an ulcer. But something just talked to me. I didn't have money within me. Something just told me to go to the hospital to find out what was happening with me. I didn't have the money. I visited the hospital using the health insurance, and I was told that I had a severe ulcer. And I was prescribed some drugs, and that was how I got, at least I had something that sustains me.
There was a time when I did surgery in Gariki Hospital. I did surgery in Gariki Hospital. I paid part of it. I think whether it's 25,000 I paid. Part of it, the surgery was supposed to be like 90,000 then. I paid part of it. That was how it helped me then.
I have one that I've been using for the past 8 to 10 years now. It has reduced the cost in all areas. You know, when you don't have cash at hand, at times that is when sickness will come. And with the health insurance scheme, you can easily, at any time, without a penny, you can go in and you'll be properly taken care of.
It has really helped me a lot. I remember when I went for surgery, I was asked to pay some amount of money in another hospital. But I remember I have this NHIS, and I went there and the price reduced. Like I take my family there for medication, for treatment. The price is always fair, you know. They have a particular percentage they allow us to use, and which is very helpful to me.
Health insurance is, well, in this country is mostly for government workers. What about the private sectors, like, you know, like the artisans who are not necessarily employed by any company? Are you hearing me? Or even the small business owners who do not have any financial reserve to even key into such health insurance. So if government wants the health insurance to cover everyone, then they will do it in such a way that whether the artisans, whether the small business owners, including the civil servant, all of them will be put into that package.
So in terms of what can be done to make people get involved in this, I would say the biggest work is people knowing. If you're not aware that there's something like this, because I am sure that a lot of people are not aware that beyond being employed and beyond being a civil servant or being employed in the formal sector, that you can't have access to health insurance. So the first step is for people to be aware, and that's where I would say even the government, we at Nigeria Health Watch, come in, increasing awareness of what is available for every level of earning for people to be able to have access to health care. Most states have the state health insurance share. For FCT, for example, they already also have theirs. So if you can't even afford the one of the national, that is about 22,000, there's the one of the FCT that you can also enroll into, and that's about 15,000. I'm not sure how much it is. So there's a level for everybody to be able to afford. And if they can't even afford any of these, the office would also assess and they can be enrolled into BHCPF. And also, I think the Vulnerable Group Fund and all of that. So everybody is accounted for in the health insurance.
So if somebody understands that concept that, oh, if I'm paying a premium, it covers me for the whole year. And maybe if I was to go to hospital on my own, that 20,000 I'm paying for premium might not even be enough to access care for once. So if we are able to pass on this message across to the ordinary man on the street, then it makes it a lot easier for us to be able to get more people signing up for health insurance.